Hi, my name is Dr. Sharma, and today I'm going to talk about DS or duodenal switch. So, what is duodenal switch? Duodenal switch is a operation which is most powerful for bariatric surgery as well as for metabolic surgery. By bariatric surgery, I means this operation has the most weight loss compared to any operation which is approved by the society. And by metabolic, I mean it has the highest cure of diabetes, blood pressure, cholesterol, and fatty liver. So essentially, this is the most powerful operation. So what exactly is done in duodenal switch? There are two components of duodenal switch. One, we reduce the size of the stomach. The reduction is done so it's not as tight as a sleeve gastrectomy, in which you convert a football shaped stomach into a banana shaped, very tight, small sleeve. This is essentially double the size of the sleeve. The advantage is the patients who undergo this operation can eat normal food. The second component is you try to rearrange the intestines so that the food travels in one channel and the digestive juice travels through the other channel. And the mixing of these two, the food and the digestive juices, takes place almost towards the end of the intestine. So there is a strong element of malabsorption. So undigested protein can reach the intestines, and which helps curing the diabetes and many other things. How is it done? Well, most surgeons traditionally perform this operation even today by open big incision. And the reason is it's a very technically challenging operations. You have two anastomosis, sleeve, and it's very hard to perform laparoscopic. However, recently many surgeons are doing it laparoscopy with tiny holes, putting the camera and looking at the monitor and doing the whole operation. The most advanced way of doing it is using the robot, which has its obvious advantage and performing the whole operation. I've been doing this operation laparoscopic for last 6 years, and we started doing robotic about 2 years back, and I've been very successful with that. So if this operation is that powerful, why not many people are getting it, or what is the reason people have not heard about this operation? Well, although this operation is the strongest operation of all, it's also the most challenging in terms of the technical skills, and it does have a little higher complications, particularly if the surgeon is not well trained for it. However, done with robot or with the experienced hand, the complications rates are not much that higher. So who gets this operation? Well, someone who has a very brittle diabetes or excessive weight, or really want to cure the metabolic syndrome, this would be the ideal operation. The other indication would be if someone has a bile reflux into the stomach. Well, essentially this operation can cure the biliary reflux as well as with exceptionally good weight loss and cure for metabolic syndrome. The third indication I would say is someone who had sleeve gastrectomy and is not happy with the results or did not reach the goal. Then this can be done as a stage procedure where you add the second component and then they can reach the goal. So these are the three indications which I usually use performing this operation. There are two types of duodenal switch. One is called the traditional duodenal switch, which has a larger sleeve and then two anastomoses. One, the small intestines with the duodenum, and the second one is from intestine to create a common channel. However, recently people have started doing a operation called as loop duodenal switch or slip procedure. The basic advantage of slip procedure is technically is much less challenging. You just bring a loop of intestine and connect it to the duodenum, so there is just one anastomosis. This is not a approved procedure, meaning it's investigational. Early results have shown good results, but traditional duodenal switch is the gold standard which is performed. So what are the advantages of duodenal switch? I think basically there are three advantages. One, patients who undergo duodenal switch can eat regular food in terms of quantity. They are not having a small portion like gastric bypass patients, which have a very small pouch and only small amount of food they can eat. Otherwise it will stretch the pouch or it will cause complications like nausea, vomiting, so on and so forth. While patients who undergo duodenal switch, they can eat almost regular amount of food because the capacity of the stomach is much larger. So that translates to more satisfaction. The second advantage is these patients, they don't develop marginal ulcer. Marginal ulcer are quite common with the gastric bypass. However, these patients rarely form marginal ulcer. And the third advantage is the sleeve portion of the duodenal switch has an intact valve. We call it pylorus. So the delivery of food from the sleeve to the intestine is regulated, meaning these patients don't develop what you call dumping syndrome, which is maybe very annoying to the patients who undergo gastric bypass. So these are the three advantages of duodenal switch. If you want to know more about duodenal switch, please visit our website sharmasurgery.com, or you can give us a call and we'll be happy to explain more. Thank you.